Tuberculosis, also known as TB, is a contagious respiratory airborne disease caused by the bacteria Mycobacterium tuberculosis. TB is spread through the air and passed to a non-infected person when an infected person coughs, sneezes, speaks, or laughs near them, and they inhale the airborne particles, which can linger in the air for several hours. Breathing in the airborne particles will cause an individual to become infected with a latent TB infection. TB is latent when the immune system is able to encapsulate the TB bacilli within the lungs and create a protective granuloma, halting further multiplication of the disease. It may take 8 to 12 weeks for the infection to become detectable. Latent TB cannot be spread to another person and is not recorded as a case of TB. TB disease is established when the latent TB bacilli overcome the immune system and multiply, resulting in progression of the disease. This can happen at any time after initial infection, often years later. People with HIV are the most susceptible to rapid progress of the disease. People with TB disease are highly infectious. Treatment for TB varies, but isoniazid and the antibiotic rifampin are considered first-line treatment for most people. Multi-drug resistant TB is a major public health concern within India because people are left with treatment options that are more toxic, more expensive, and less effective. Testing for TB can be completed through a TB skin test, otherwise known as the Mantoux tuberculin skin test, TST, or through a blood test known as the interferon gamma release assays, or IGRAs. Screening for TB can be completed with the use of chest x-rays and CT scans. TB presents with no symptoms. TB disease, or active TB, presents with symptoms such as a cough lasting 3 weeks or more, fever, pain in the chest, night sweats, and coughing up bloody sputum. TB remains a major global health burden. According to the World Health Organization, TB is among the top 10 causes of death worldwide, and prior to COVID-19, it was the leading cause of death from an infectious disease. India accounts for 26% of the total global disease burden. Therefore, the NTB epidemic by 2025 was included within the Sustainable Development Goal number 3. According to the World Health Organization's Global TB Report for 2022, most of the global reduction in the reported number of people newly diagnosed with TB between the years 2020 and 2021 was accounted for by India. The report states that India's TB incidence for the year 2021 was 210 per 100,000 population, which was 19% lower than in 2019. According to the National TB Prevalence Survey in India, the prevalence of TB for all ages in India was 312 per 100,000 population, with a 95% confidence interval for the year of 2021. The prevalence was higher among males than females and in rural areas compared to urban areas. Higher prevalence of TB was observed in older age groups, males, malnourished people, people with HIV, smokers, alcoholics, and people with diabetes. According to the Global TB Report, the estimated mortality rate among all forms of TB in India was 37 per 100,000 population in 2021. Without treatment, the death rate for TB disease is high. It's about 50%. The total number of estimated deaths in India from all forms of TB for 2021 was 493,000, which was 13% higher than that of the year 2020. Prior to the COVID-19 pandemic, India was on track to meet the targets for the NTB SDG number 3. Progress during the last couple of years during the pandemic has slowed compared to progress made in the years up to 2019. Although India reports a decrease in incidence, the World Health Organization concedes that any reduction in TB case notifications compared with that of the pre-2020 trends was due to delays in diagnosis and treatment initiation. Due to the global pandemic and lack of universal healthcare in India, the healthcare system is under stress. India's public health infrastructure has had little resilience with managing both the TB epidemic and the COVID-19 pandemic simultaneously. Therefore, preventative measures such as early detection have received little attention due to diverted resource allocation. All community supports were interrupted during the pandemic. Therefore, it is expected that the healthcare system will be flooded with more people to diagnose, treat, and provide financial assistance to. Also, people will be presenting sicker than previously before due to avoiding medical treatment during the pandemic, which will lead to an increase in community transmission. Overall, TB incidence and mortality may increase in India due to lack of detection, services, and treatments over the last couple of years.
The image shown on this slide shows all social determinants related to TB and provides examples on how the determinant is impacted. They are all important, but it was determined that the most important social determinants of TB include poverty, lack of education, lack of medical care, undernutrition, and environmental living. Social determinants that affect the population of India suffering from TB play a large role in the outcome of the patient's health and the spread of the bacteria. Poverty rates are high in India, and this limits the population's access to adequate health care, vaccinations, and preventative medicine. It also affects their ability to access early testing and drug treatment to prevent the spread of TB. The people are also uneducated in impoverished areas, and they will not understand or be informed about hygiene and cleanliness, nor would they know ways to prevent catching and spreading the disease. Since TB is airborne, coughing etiquette, hand hygiene, and regular cleaning would be helpful in not spreading TB. Poor air quality, such as moisture, cigarette smoking, and other irritants, provide a perfect environment for TB to multiply in unchecked areas. Being that India is an impoverished country, the people would not be able to access clean water and adequate nutrition. Poor nutrition results in an already compromised immune system, which exacerbates a person's ability to fight the disease and recover, and therefore extends the life cycle of the bacteria, increasing its ability to spread to other people living in the proximity. Discrimination against gender, social caste, and indigenous communities would also adversely affect an individual's ability to access adequate health care to treat their symptoms, slow the progression, and prevent the spread. Overall, experts have determined that there should be a pro-poor model of patient-centered care, and it is crucial and must include nutrition, psychosocial, and financial support, universal health coverage, with also having sections that focus on addressing the poverty, undernutrition, unsafe housing, and indoor pollution that is happening currently in India.
India is an extremely densely populated country, one of the most densely populated in the world. The World Data Bank shows that there are approximately 464 people per square kilometer. This has increased from 150 people per square kilometer in 1965. The current estimated population is 1.4 billion people in a country which is 1.2 million square miles. India's population is roughly 20% of the entire world's population. So how is population density a challenge to public health? The more densely populated an area is, the more people are in direct contact with infectious disease and are at an increased risk of contracting disease. For public health teams, this also means more surveillance and contact tracing, along with more medications needing for prophylaxis and more follow-up and monitoring. A 2013 census shows that 1 in 6 Indian citizens are living in slums that are unfit for human habitation. These slums do not provide proper shelter, with most of them being improvised of discarded materials such as cardboard, flimsy plywood, and other various construction materials. These slums have no running water or plumbing, electricity, or ventilation. Many slum houses are shared by more than one family. These families do not have reliable or sufficient income to support their household, and therefore do not have sufficient access to healthcare or nutritious foods. And why is this a challenge for public health? Unfortunately, all diseases thrive when humans live in conditions such as these. Cholera outbreaks are common in slums, and the spread of TB is rampant in these cramped and unventilated living quarters that are filled with individuals who are already at risk due to poor health and poor nutrition status. The task of stopping the spread and treating active cases is astronomical when faced with TB in the slums. It takes a large task force, lots of government money, and commitment from the community to tackle this issue. About 20% of India's population are chronically undernourished. Data shows that in tuberculous endemic India, malnutrition is a significant factor in TB spread and incidence. It is also associated with poor treatment outcomes. Studies show that malnutrition affects the body's innate and adaptive immune response to control Mycobacterium tuberculosis. These same hindrances to the body's immune response also affects the uptake of the BCG vaccine in the body. Addressing undernutrition is a vital step in the WHO End TB strategy. However, this poses significant challenges to the country's already stretched public health system. To address nutrition, there needs to be affordable, sustainable, and long-term solutions. It is not as simple as giving people food. It is about helping people develop the ability to feed themselves properly over a lifetime. This includes education about cooking, access to affordable foods, tools, seeds, and space to grow food. To see the positive effects of proper nutrition will take about a generation. This is not a quick fix, but one that is necessary. Although there is a vaccine for TB, its efficacy is not always reliable, and it is only effective in childhood TB and not in adult TB. The cost of this vaccine is relatively low, and it is a very accessible vaccine. Although the administration of the vaccine is not prohibitive by cost or access, the challenge will be to come up with a viable plan of action to immunize vast amounts of vulnerable children. That means that teams of healthcare professionals will have to go to the children rather than the children going to them.
Unfortunately, there are some aspects of tuberculosis in India which cannot easily be fixed. This may include the lack of infrastructure and access to public health care. However, there are measures that can be taken which may aid in decreasing the rate of TB in India. For starters, it would involve enhancing living conditions to make disease less prominent. It would also involve getting government funding to creating proper healthcare infrastructure which has proper ventilation. It would also be important for those to self-isolate when they have been exposed or know somebody who has been exposed to TB, and it would also be very important to educate the public on vaccine treatment.
The only effective available treatment for TB is directly observed treatment short course. This is a lengthy treatment totaling 6 to 9 months, causing many side effects as well as drug resistance due to non-compliance of treatment. The population most at risk is low-income people with little to no access to treatment. The challenge to public health is to effectively treat populations. Infected individuals require definitive diagnostic testing by a sputum smear. The treatment then requires 2 months of directly observed treatment for TB and then another 4 to 7 months of continuing treatment, which are unobserved. An uninterrupted supply of anti-TB drugs is required. Reliable and accessible lab facilities are also required for diagnostics. A standardized recording and reporting system that allows assessment of and treatment results for each patient and of the TB control program overall are also required.